nguka au ni encourage tu nisome, ati nikuwe kama hawa watu wako kwa parliament kama Martha Karua hivyo. In future ningetaka kukuwa doctor, kwa sababu mtu akiwa doctor usave lives za watu na bado ukiwa doctor iko na parts nyingi. Wale watoto wako huko nje, kwa vile mimi nimepitia huko kwote na nimeweza saizi kusucceed, kwa sababu mimi saizi na feel niko successful. Hata kabla ya KCP ningetaka kuambia, kwa sababu mimi wakati huo sikuwa nafungua roho yangu niseme chenye na feel, wakuwa wakifungulia wazazi wao roho zao, au wenye wana wazazi wafungulia guardians zao na accept life kama vile iko na wajaribu their best, wata succeed.
We did training for all the staffs in the 3 sections, and out of this we've seen great improvement during the case conference. This is a meeting that all the partners, educators, counselors and reintegrators meet to finalize on children issues.
Of great importance is what we call case conferencing. This is a forum whereby the staff, the government staff and other stakeholders, partners, we come in together once every week and we discuss cases of children, each individual child. And how we do it is that the counselors, after counseling the children, they come up with issues concerning any particular child. The educators also on their side, when they are with the children out there, they are playing with the children, they are doing any other activities with the children, they are able to gather information about a particular child. So then what we do during case conference is to come and discuss what the issues are concerning that child, and then we come up with a way forward.
Educators bring out whatever they learned from the physical point of view, what you see, what you observe when you're doing these activities, the emotions that are coming out, the frustrations in some of these children.
As a reform agenda within the department, this institution as a facility was started in 1996. As a reform agenda in the department, we were obligated to separate children in need of care and protection and children and child offenders. From 2007, we have been able to work afresh and different from a rehabilitation school. What the children need in a care and protection setting, they need families. They need families and they need adults to be close to them. So we have also set up what we call Thika Children's Rescue Center family units. So what we have done is to make sure that out of, for example, 100 children, they are divided into 10 units of 10 each. So, and so far we have 10 units, and each unit has at least 2 staff. These 2 staff act as the caregivers. A different way of doing things. It is part of reforms. Because maybe in the past, when children are put together, we deal with them as groups. Groups of 100, groups of 50, and we deal with them like numbers. What we've done in this reform thing is that we look at children as individuals. We want to make the institution as close as possible to a home outside there.
kama ameshachizi, lakini hawajui aliye ndani yangu ashanikwacha. Pestumeni bamba, pestumeni kwachu, ndio maana everyday nakupa hizi praisings.
Recently launched a program which is on behavior change, and sometime last year 20 children underwent a training for 3 days with 3 members of staff where they went through a peer education program. The purpose of this program really is so that the children become models and so that other children learn from them, and thus we're able to focus more on rehabilitation. This program has also assisted the staff because there's teamwork. We have also had a couple of workshops together. This has brought us together as a family. There's motivation because also the communication has improved, and I think also the focus on the institution has changed such that we are now dealing with behavior change other than before when we were more academic orientated.
From the experience of Cefa working in Nairobi Children's Remandom from 2005 to 2007, it was found that a few gaps were existing in terms of service delivery to children concerning the field services. One of the gaps that was identified was that there was a skeleton staff at the DCO's office which could not be able to complement the reintegration of children from the institutions. The coordination of services within the field was found to be wanting. The areas of Embakasi and Kasarani were contributing a substantial number of children to the Nairobi Children's Remandom. So an intervention was designed to those areas, and this intervention was geared towards addressing the district child protection system. It's a collective mechanism of state and non-state actors towards addressing issues of child protection and prevention of abuse. It is a system that has the DCO, District Children's Office, as the focal point, while the other stakeholders work in relation to this office. Cefa, for the last 3 years, has been able to work with this system, assisting the office to develop community-based human resource structures. These are persons drawn from the community who are volunteering their services, some who are formed by law and others who are brought in by their own volition. The first structure that we worked together with the office to form was the Volunteer Children Officers, commonly known as VCOs, who are individuals drawn from the community offering human resource to address children issues within their community. In a span of about 7 months, Cefa, together with the office, was able to develop a document that is workable and which we are recommending to the Department of Children's Services for adoption, because it brings down to the reality the situation of how a volunteer children officer could work on a day-to-day basis. The other documents that you are able to produce were the rescue protocol and the reintegration protocols. We provide clear guidelines on how to work within those thematic areas. Secondly, we had the locational area advisory councils, which is a devolved structure of the area advisory council to address child protection issues and awareness creation within their communities. The third structure was the village elders, which is a structure operating principally under the provincial administration, but which handles children within the chief's offices whenever wananchi take complaints to them. Looking at these 3 structures, we were able, together with the DC offices, to harness them and form 8 locational area advisory councils. We've trained over 28 volunteer children officers, and we've trained over 200 village elders in the span of 3 years. All these structures are still existing as of now, still in working with the District Children's Office And in addressing one of the gaps earlier identified, the one of coordination of stakeholders, Cefa took in a lead role and brought in technical expertise in terms of mobilization and harnessing of the stakeholders to form themselves into thematic areas. This has given birth to vibrant stakeholders networks in the two districts. Further informed by the need to have a preventive component within the two districts, Cefa undertook on a pilot basis to engage the key stakeholders of one of the areas which was affecting our children, that is the schools. 21 schools through the Nairobi City Council were involved in a program of having a participatory educative theater, which was an awareness creation methodology, and also having a school and community networking program whereby the schools looked outside the environment to be able to harness resources to address the issues dealing with children. The success of this is that over 20,000 parents were reached in a space of 3 years, and physical infrastructure has been built in over 21 schools. After 6 years of working in both field and institutions, we recommend that the good practices that we have been able to develop together be adopted and applied by both the Department for Children's Services and the civil society serving children.
But I'm not the only one. There are so many things that I wanna do, things that I would like to become. Nothing is impossible cause I got the power. Now I'm jumping obstacles and moving forward. I can be a millionaire and have fancy cars. I can be an astronaut and fly to Mars. I can be a chief chef cause I like to cook. I can be a top model cause I got the looks. I can build my castle, not sleep in the cold. I can be an athlete, I keep bringing the gold. It's not about if I do or I don't have cards. It's about where I'm going, not about the past. Yeah, man. Oh, fun me in the building. Yeah, just keep dreaming, just keep dreaming. Yeah.
You have to see it before you can be it. You have to keep on dreaming. You have to visualize before you can realize. Just keep on dreaming.
I dream and I make sure that it comes true. I can break the world record and set an example. I can be the next president.